Check 1, 2. How's that sound? Doing it for us.
Can you see me? You can't see me.
Is that a line level or is it got going there?
The input mic input level's only at 66, so
Is it mic level or line?
mic level is 6.
I'm gonna turn it down what I think. Let's try it out.
Check. This is Paul Pettit from the. Still, how's it sound?
Well, that's keeping track of my activity, so I know I'm still alive. Like my heartbeat is.
Check 1, 2, 3, 4. Not hearing anything? Okay. I'm just going to run the boom mic.
Check, check.
I think it should not. Let me just show it. Well, I'm going to leave that good thing.
Shelley,
So maybe it's just,
could you give me a 1 minute before?
I can't do that. We're gonna start at 4, so you can do
Straight up?
3:59. Thank you.
So you just do a quick intro. Okay, is Jay, I mean, they may have questions about some over here.
Okay, Shelley, if you're monitoring, don't forget to roll the tape in the newsroom or ask them to
Roll. Talk through some of it. Not be what all the time.
Shelley. Shelley who? Okay, roll it, roll it. Roll it, Nikki.
6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. Ready?
See,
Still?
another in a series of daily briefings on global impact of the COVID-19 virus. Our speaker is the chairperson of the Genesee County Legislature, Shelley Stein. She's approached the podium now. We'll begin momentarily. We'll also be hearing
Good afternoon. I'd like to welcome you to Genesee County's afternoon briefing for March 18th. My name is Rochelle Stein. I serve as the chair of the legislature. Joining me today is our Public Health Director, Paul Pettit, and also our Ways and Means Chair, Marianne Clattenburg, legislator from the city, and our County Manager, Jay Gazelle. Paul, please.
Good afternoon, and thank you again, Madam Chairman, for the introduction. So again, Paul Pettit here, your Public Health Director, and I just want to provide a brief situational update on obviously the COVID-19 outbreak and what's going on here in Genesee and Orleans County. As we reported yesterday, we had one case confirmed in Genesee County, and as I speak right now, and again, this is fluid, I want to continue to reiterate the fact that as we move forward, we're getting results back. We're sending swabs in. There's swabs going in from our providers in our community daily and throughout the day. So as I speak right now, there still is only one case confirmed in Genesee County. And in Orleans County, there are 0 cases. Again, we continue to hear feedback and information coming from different folks and different sources that there's more than one case, that there's cases in Orleans County. And I want to reiterate, I've been saying this the past couple days, that we will receive calls directly from the state lab upon any positive cases. Again, there may be some misunderstanding or some situations where there may be positives from other counties, or people may be exposed, potentially under quarantine from exposures for other counties. Again, being a very fluid situation, that is occurring. This contact tracing is a very complex thing to do, but again, we will be reporting positives, and we will have that information up for folks. So again, one confirmed case of COVID-19 in Genesee County, and still 0 cases confirmed in Orleans County. A little bit of situational update on our quarantines. So again, we've been talking about this daily. Genesee County, there are 7 people under precautionary quarantine. There are currently 10 people under mandatory quarantine. So that is a significant increase from yesterday. And again, we'll talk about that in relation to our positive confirmed case. There is also 1 person, positive case, again, under mandatory isolation in Genesee County, and that is our confirmed case that we talked about yesterday. In Orleans County, we have 2 people under precautionary quarantine and 5 people under mandatory quarantine. So again, not a lot of change in numbers in Orleans County. I believe we had 5 yesterday. We still have 5. We have 2 more under precautionary. And there are 0 people under mandatory isolation, again, that we have 0 positives. So I want to speak a little bit about the case from yesterday. As I said, when I came with this report, we had just literally found out about the case at about 3:15 when I came over here, so we did not have a lot of information. My staff, my nurses, my epi folks have been working diligently since we found out about that to do this contact tracing. And as I said yesterday, it's really building that story. It's looking backwards and trying to figure out who this individual was in contact with, when they were in contact with them, do they meet the definition around contact? And that's what we've been doing, obviously, for the last 24 hours. So what we know now, and again, how we look at these, just a little bit of an explanation on these epi investigations and contact tracing. We have, it's kind of like a circle, right? So we have our case, we look at layers, right? So the first layer, the second layer, the third layer, and that's really based upon contact with the individual. So what we do is try to find out who was in direct contact with that person during the time frame when they were symptomatic. Again, that's when they would be shedding the virus, and we go back at least minimum of 24 hours before that time period. So what we do know is that we have identified all of the direct level 1, as we're calling them, contacts with this individual from the time they were symptomatic. All of those folks have been placed on mandated quarantine, and they've all been issued those orders. They are all being compliant, and they're all aware of the situation. And we have, we're continuing to monitor them. There are a couple of them that are symptomatic, and that we have swabbed as indicated. Again, if folks are symptomatic, we are swabbing them, again, to test for COVID-19. Again, when we get those results back, we may have some additional folks under isolation, but at this moment, it's just the 1. But all of the direct level 1 contacts are under mandated quarantine and are being monitored daily. They will be checked daily by one of our nurses and called again additionally for a second point of contact. We also continue to look at those level 2 contacts. So again, these are the folks that may not have been in direct contact with that person or for a prolonged time, but we have some concerns or suspicion around. And those folks, we have also identified, we believe the majority of them, again, based on investigation interviews. And those folks that have had that contact that we are aware of at the moment have also been placed on mandatory quarantine. So again, as we work this story backwards, we continue to identify those folks and put them under the appropriate level of quarantine and monitoring, and we'll continue to do that. Again, we're going to be following the investigation where it leads us. That's really how we do these things. We have to go systematically, look for connections, look for associations, and how there may have been contact with the case. At this point, there's been some things out there, obviously, around Girl Scouts. We've heard that through the media, not the media, but some different social networks and things, and some calls. I do want to report that we are working closely with the Girl Scouts of America. We have been in contact with them throughout the day, and there is an association with our case with the Girl Scouts of America, and we have been, again, looking at those potential contacts. Again, anybody that has been identified at the moment, we have put under quarantine, even in association with that. But at the moment, it's ongoing, and we're continuing to trace that backwards. They are being, the Girl Scouts of America are being very cooperative in providing us information to help us in that investigation. At this point, the relative risk to the general public, again, as we talked about in regards to this case, remains very low. Through our investigation, we have a very good timeline of where this individual has been and where they've gone, and we have made, again, most of those contacts at the moment and put those folks under quarantine as warranted. We'll continue this investigation, continuing to trace it backwards as we go forward. And again, you notice we're not providing a lot of details specifically around certain things, again, because we are bound by HIPAA, we're bound by health information laws, and we have to be careful with what we're saying. Regardless of what may be out there in social media and what others have already put out there, we are bound to keep those levels of privacy intact. I'll take some questions a little bit on that, but I did want to, again, report a few other things that we've been talking about. So yesterday we spent a little bit of time talking about swabbing. We're talking about our different swabbing drive-through sites, capacity in our communities. And I want to report again today, and unfortunately I do not have better news, but we're trying to be transparent and trying to let our folks know real-time information as best we can that's factual, that's informative, and local, right? So we continue to be waiting to receive our shipment of swab kits. And unfortunately, this is not something that we are unique in. As I reported yesterday, all of the Western New York counties, so all of our counterparts are in a very similar situation. We continue to work with our emergency management officer, Tim Yeager, and his staff, and they continually are putting in requests daily trying to get this information. And unfortunately, it's been very challenging. There's just a shortage. There's just not available, contrary to what we are hearing from the federal government, from the state government on, folks wanting to get swabbed can get swabbed. Unfortunately, locally, that's not the case at the moment, and we're working as hard as we can to provide that capacity to our residents. There is some smaller swabbing sites going on within the county relative to healthcare providers, which again is why we are telling folks to call your healthcare provider first. That should be your first point of contact. If you have any type of respiratory illness or symptoms, call them. Again, they may have the swab kits, and we're going to be triaging, as we've been talking about the last couple days, based on the criteria. Again, elderly folks, those that are immune compromised, that are highest impacted by COVID-19. So when you call up, you're going to be screened if you're symptomatic, and again, if there's swabs available, they will work to get you swabbed. So there is a little bit of swabbing occurring in the county. We do have a very, very limited amount of swab kits in the health department, again, that we're working with our folks related to this case. But as far as widespread community swabbing, that is still not available. And we are working and doing our best to make that available as soon as we can. Just a reminder again, we want folks to be calling ahead if you have symptoms, because we're getting a lot of reports of folks out in the community that may be symptomatic of respiratory illness. Again, we're going to continue to report out that flu still remains very prevalent in our communities. So if you are having respiratory illness, it does not necessarily mean you have COVID-19. You may have the flu, or you may have some other respiratory illness. Regardless of what it is, we're asking folks to stay home. This is no different than our messaging that we do year-round when you have flu. If you're sick, if you have symptoms, stay home, stay away from folks, self-isolate. So that's the best thing you can do. The other thing we're hearing is folks, again, this rumor mill of, I was in contact with someone who was in contact with someone who was in contact with a positive. Again, we understand the anxiety, we understand the concern, and just the questions that are being asked. And we're trying to get the message out to folks. If you have those type of questions, there is the hotline that we're asking folks to call that we've been published. It's part of the material that's out there. It's on the websites. Those are for general questions. Those are for those type of scenarios where they're kind of the 2-3 person removed scenarios. So we would ask folks to use that because, again, we are not locally able to handle all those calls. We're really trying to triage and deal with those that are at our highest risk populations at the moment. Again, our basic PPE, call ahead. We don't want to swamp our emergency rooms, our healthcare systems. Again, stay home if you're sick, wash your hands. Self-isolation is really what we want to continue to put forward as our messaging at this point. Those are the brief updates I have. Did you have anything?
Just a couple things real quick.
Okay, so I'm going to turn it over to Jay, and then I think we have a few minutes anyways for questions, and we can try to clarify and bring forward any information that you have on other things.
Thanks, Paul. Very quickly, as Paul just indicated, we're trying to keep these press briefings strictly to the county health planning and the COVID-19 and all the related issues as far as that's concerned. We have information that we are going to keep giving out. I just handed out 2 pieces of paper here to the local media with regard to information the county is putting out for county workforce, and also with regard to our mandate, so to speak, to put together a plan as far as what our workforce is not looking like in our county buildings. But also a listing as far as all of our county departments. Now that many of our buildings are not functional with full-time employees and people cannot go into the buildings on a regular basis, here's the other way for people to contact them and continue to do their business. As Paul mentioned also, with regard to emergency management and these caches of product and protective masks, as well as sanitizing media, those things are still in some kind of waiting to be delivered. We've put in a request for 3 of those here in Genesee County. There's a priority list that's being put together, working with first responders, providers, hospitals, nursing homes also, because they are experiencing the same dearth of this stuff. As Paul indicated, people are asking, well, when can I go get this? How can I get some of this? How can I keep myself and the people I deal with clean and somewhat germ-free? We do not have that stuff yet. We've been putting in the request. Also, as I indicated, putting together a list of priorities, working with County EMS and the County Planning Department. We also ask people to be very patient and, again, utilize the information that's being put out in these releases, but also to the effect that this is changing literally by the day, the half day, with regard to what's coming out of both Albany and Washington, D.C., with regard to both emerging legislation, executive orders, and interpretations administratively by administrative agencies of the state of New York and how they're dealing with us and information they're imparting to us. So that's basically the second message. And Marianne, do you?
Okay, so if you guys have any specific questions, we can try to provide you as many updates as we can. And yeah. Yeah, absolutely. So as I mentioned, we are in contact with them, and we are looking at any potential contacts through that. Through those exposures potentially, right? And again, we have identified a few at the moment, and we have placed a couple of those folks under mandatory quarantine where there was contact through the Girl Scout contact, or through the organization. So then you're not only investigating, but there has been contact. Yeah. So again, we are following through, and again, regardless of whether they were with the Girl Scouts or not, it's contacts, right? So that's really what we're looking at: is where did this person go? Who did they come in contact with? Again, in lines with the exposure within 6 foot. And those are folks that have been identified, and as we identify them, they're being put under the appropriate quarantine.
So, point I want to clarify, so you have here the mandatory isolation that we discussed yesterday.
Yes.
Positive case. There are additional contacts that are also now in isolation. Some of those are symptomatic. On the trace part of it, for those people that are symptomatic and not yet tested positive, are
Yes.
you tracing them? What level of
Yeah.
depth are you going to as far as their contacts at this point, even though you're not sure they're positive?
Yeah, so great question. So what we do is the web gets bigger, right? So that's really where the road leads with a lot of these. Once we start to identify those direct immediate contacts, and we put them under quarantine, while we test them, right? They are locked down, we monitor them, but while we wait, we're talking to them, we're doing that next level investigation. So who may have they been in contact with again? So we're going back from when they became symptomatic. So it's not necessarily as far back as the index case, the initial one, right? It's kind of a moving timeline. So we are currently already looking at that and trying to identify those. So if they do end up coming back positive for COVID-19, then again, we start those rings around those people.
But you don't do the trace on them, is what I thought.
We're starting to have those conversations preliminarily, yep.
And to the Girl Scout question, I know you're trying to really stay within the
Mm-hmm.
letter of the law and everything. For anybody who has had any contact with the Girl Scouts organization within the last week or two, would you encourage them to be extra careful about not going out in public and social distancing and everything?
Well, I mean, the message is the same for all that we've been saying over again, right? So regardless whether you have worked with the Girl Scouts or part of that organization or anybody else in any of our communities in Genesee County or Orleans County, we need to think precautionarily at these times. Again, we're going back to symptomology. If you feel any type of respiratory illness, we're asking folks to stay home, self-isolate. So we're not asking anybody to do anything different, whether you're with the Girl Scouts organization or not. Again, we will be contacting those folks where there was touch points, to this case.
I have more questions, but I'll let others go.
One other thing I can also indicate, from now on, probably starting either tomorrow or Friday, these things will be done remotely. For our social distancing purposes, we'll probably be using the Zoom technology because we don't want this guy basically spending 2 hours a day traipsing back and forth when he really can concentrate on having facts and information for you. So from this end, and with regard to something we did yesterday, we think our Zoom technology, what we'll do is also give out that number prior to 4 o'clock on each day during the weekdays as far as what to call into, and then hopefully be able to set up the Zoom technology and the interaction between we type people and you folks in the media.
I appreciate that. That's important.
Yeah.
So you talked about masks.
Yep.
In supply masks. Something I learned today. People think like there's a run on N95 masks at Home Depot. People think they'll protect them. Actually, something I read today indicates that really what you need is a more medical mask that has a finer mesh in it
Yeah.
to keep out the virus, and that those are in short supply in part because you can't stockpile them because they have limited shelf life.
Mm-hmm.
Is that correct? Is that part of the problem?
Yeah, so we can talk about masks briefly. I don't want to get too deep in the weeds on this, but so the N95 masks, again, those are for folks, especially on the healthcare provider side. They're to protect the person that's working with the individual, right? So we want to make sure that we're not buying up and hoarding, if you can get them, any of the N95 masks, because we need those for our healthcare professionals, our first responders. And as we said, with the shortages and our ability to get masks and supplies in, we don't want to end up in a situation where we cannot protect those that we're relying on to respond, whether it's COVID-19 or any other type of response in our communities. There is a difference, obviously, between the N95 and the basic surgical type masks. Obviously, we're encouraging folks, if they're symptomatic, again, when they go in the doctor's offices, you go into buildings, you see a box of them sometimes, and they say, if you have a cough, you're symptomatic, put that on, because what that's doing is protecting others from the symptomatic person. So if they're coughing and stuff, and it's capturing stuff within to some extent. The N95s are again protecting the providers on the other side. So there is a shelf life on these masks for both the N95s and the general surgical type mask, and it's not necessarily that the masks themselves go bad, because the filter system doesn't wear down over time. It's the rubber bands. So really what happens is over time, these bands that are supposed to hold the mask tight to the face, it's rubber, right? So it can break down, and the concern is we don't want someone to have a mask on where the rubber has stretched or is not as tight anymore, and you may break that seal. And unfortunately, maybe have an incidental exposure because you're using a mask that is out of date. There has been some consideration and some relief by the CDC around masks, where they are allowing expired masks of certain models and brands going back 6 months to a year, again, to help with the shortage and help us with making sure that we have folks protected, again, as the supply for current outdated masks is an issue. So.
And the other thing is, I respect when you talk about testing that you're being delicate here, but I want to put it out there because I don't know that necessarily a lot of people that are following this closely understand that there's, the media reports complaints that the United States turned down
Yeah, I mean, I can't comment too much on the national level. I mean, we're obviously, that's out of our realm and out of our wheelhouse, anything we can control. I mean, woulda, coulda, shoulda, I mean, those are all things that we can debate later on, right? The reality is we need to focus on what's going on the ground in our community, and that's what we're doing here locally with county government and what we're doing in the health department. And I can tell you, like I told you yesterday, we are pushing back. We're saying we need these. We're being as aggressive as we can. Any type of time, anytime you have community spread, we need to identify cases, right? So that's how we contain, that's how we isolate and quarantine folks to, again, try to minimize that continual train of exposure. So all I can tell you is we are doing our best. We are trying to get those swab kits. And in the interim, the control measure, right, the mitigation control measure is stay home. Don't be out if you're symptomatic, because if you happen to have COVID-19 or influenza or any other type of infectious disease, we don't want you out in our community. And a lot of the, again, unprecedented control measures that we've been implementing here across the state and the country and around the world are directly to do that, is to provide that isolation and keep people apart to break the chain, to break the spread, to flatten the curve that we keep talking about.
Knowing what you know, does it increase your anxiety that we don't have distance?
I wouldn't say it's increasing my anxiety personally. I mean, it's more increasing my anxiety for our folks, because I know there's a lot of people that are anxious and want answers and want to know why we can't swab, and that's the hardest part of our job, is we want to help. We want to try to get folks to the access and to the level of care that they need, and it's more frustration, I think, than anxiety on my part. I'm frustrated that we can't help our folks and get them the services and the type of care that they're asking for and they should have, and that's why we're continuing to push and fight for it on a daily basis. Yeah, so you probably see that on the statewide level. The governor is starting to look at alternate sites to stand up as kind of those temporary hospital or temporary beds to deal with folks if we start to get numbers where, that need hospitalization or higher level of care, that they can't, potentially ride out the symptoms within their homes. I'm not sure directly of anything locally. I mean, obviously we have our healthcare system at UMMC. I know there's there's been around some college dorms and other places around the state that they're looking to stand up as potential, makeshift hospital type settings. Again, I think that's going to be kind of driven on the state level to identify those, because they have to, again, meet some level of standard and ability to house these folks safely and protect those that are caring for them. So we will obviously, if we're asked and we're talked to about any of those locations, we would be in discussions with them and relay that at the time.
So you're not planning on it here locally in case you get around and do get testing?
Yeah. So again, when we start getting the swabbing, again, we got to go back to the numbers. I mean, 80 to 85% of folks are going to have mild related symptoms to COVID-19. They'll be able to self-isolate at home throughout the duration of their illness and recover and not have any long-term illness or impact from this. The concern around, again, is maybe that 15% that may need some level of hospital care, and then there's that 5%. Again, these are ballpark ranges that may need that are more severe and may need some higher level of care for a little bit longer of a duration. So again, capacity, we've been talking about it the last couple of days, is a concern. We have one local hospital and health system with limited beds, still full of influenza and other medical issues, and it's a concern. And that's why, again, we're really needing folks to adhere to the guidance, to adhere to the messaging that's out there. Stay home if you're sick. Keep your separations. I know it can be painful, and it's not what people want to do, but the reality is we need to free up capacity in our healthcare system. And that's why the governor is currently looking at alternate sites to provide additional capacity, because at the moment, a lot of our beds are still full. And we need to make room for folks if they do have a higher level of severity with this illness so that we can handle them. Again, going back to what we keep talking about, flatten the curve, push it out. Let's free up some capacity in our healthcare system so we can respond to those that need it.
Mr. Pettit, just
Marianne, can you want us to have input? Marianne?
We have to wrap this up because we have Ways and Means and a special meeting to address some of these concerns. I'm Marianne Clantenberg. I just want to thank our hardworking staff, all the employees of Genesee County, particularly our public health director, and the citizens of Genesee County who are doing a remarkable job. under these circumstances. I know there's lots of students home today, and I was teaching some of them from my house. Great job with that, parents. We can get through this together. Let's listen to our public officials. And I just want to give a big thank you to everyone who's working so hard on this, and especially to the press as well, because you're our connection to the people, and we really appreciate you and need you at this time. So thank you very much.
We hope it will, Alicia, tomorrow. We just have to make sure, based on the strength and where we're going to do it from. We got some logistics we're trying to work out. We'll let you know beforehand. You'll see a note from us because you're on our list as to whether or not we're going to start tomorrow Zoom, maybe Friday, or definitely starting as of Monday. So again, correct. Right, unless you hear otherwise. But again, I can't keep asking this guy to spend